Hello, everybody. Welcome to our next greatest adventure here at Healthcare Express. We're bringing you our first educational video for everybody. We are going to focus today on differential diagnosis and how to use them. And today, to bring that to you is Alex Donnelly. So, Alex, take it away.
Well, hello, everybody. My name is Alex Donnelly, and I'm here today to tell y'all a little bit about my story and how I started to increase my level 4 numbers. And so I'll get started. So when Dr. Kaltwriter started putting out the emails that had everyone's numbers and where you stood on the level 3, level 4 charting, I and even though I thought I was getting level 4 charts, it appears as though I wasn't week by week. And so I just started looking at everybody else's numbers and thought, if I want to be in the 90%, I need to look at those who are already in the 90%, which prompted me to call Jerry Browning because he was constantly getting 94, 96, 97% on his level 4 charts. And after talking with him, I was told, his templates are public on ECW, and that's sort of how he gets all his level 4s, is he's created a streamlined, easy process for himself. And so I decided, well, they're there for my use. I'm going to try to use them. So that's what I did. I found his templates and used them as a skeleton for my own. And I, personalized them a little bit to fit my verbiage and, what I do as a provider that may have been different than his, and updated some of them from ICD-9 to ICD-10 coding and things of that nature. And so once I realized that it was as easy as using the right verbiage, then it all kind of seemed to fall into place for me, because it was not that I wasn't doing or saying these things. I just didn't know how to say them correct and concise enough for billing and coding purposes. But Jerry figured that out. And so thank you, Jerry. We do owe him for my level 4 charts. So I just created personalized templates of my own and went from there. And I'm still updating them and changing them as I see fit. But ultimately, that was the start of this. And I will show you all kind of how that's done, or how I've done that. And, you may see something that you would do different, but I'll share my screen with you guys and go over how it happens. So under templates here, I have a plethora of some that I need to clean up, but for the most part, any of them that I've updated, like for the one I'm going to use now for this UTI, it's one that we can make available to everybody. So anyways, this person here is here with dysuria, so I'm going to pull over my UTI template. And I think everybody knows how to get to the templates lists, but here it is. Most of you probably already have your own. And so a bunch of stuff comes over, things that may or may not need to change for you guys. But if you'll click in under HPI for this particular one, you get to customize it according to what the patient is telling you. So I'll go ahead and do that here. But most of all of this is going to remain the same on every patient. Very few of them are actually different when they come in with a UTI, so I'll just leave this as it is. But I give myself little blanks and other templates that go, okay, this is going to change on people. So for one of the other ways to get a level 4 chart, especially when it comes to UTIs, is that if this is a person who has a chronic history of UTI, I always make sure that I include that in my chart, just so that it gives the billers and gives the coders what they need to see it as a complex chronic condition. And in this, it pulls over the CHPI, it pulls over my pain management that I'll need for some of the insurances. It brings over a pretty generalized assessment, which you can update and take out as you do or don't need, change according to the individual patient. And then you'll come down here, and I already have in most of my templates medications, and these are all based off the EMRA and up-to-date guidelines. So you may do something a little different, but on any of my templates, I try to go based off what they recommend as first line. And so I will go into this and we'll just pretend they had a little blood on the dipstick and add that in. And so one of the main points here is this snippet right here. This is very important for level 4 charts from what I've learned, because this was a game changer from that will take you from level 3 to level 4, is that you talk about these things. And these are things that you already do. You do talk about, what your diagnosis is. You tell them, you have a UTI. You talk about the plan of care and reasons to return. There's probably very rarely a time you tell somebody, if this doesn't get better, come back, or if it gets worse, go to the ER. So I was doing those things and I just didn't know how to say them. And ultimately, what I did when I did say it was I talked myself out of a high complex chart, especially with the MDM that I was doing, that I now still do, but more so in just differentials, which I'll get to. But I was using my MDM to tell myself, and I guess anybody viewing the chart, that this is the reason why it isn't a, bladder cancer or whatever the case may be. And so that just decreases the complexity of the chart, which now I know you can say it this way and you get all of the same information, but without talking yourself out of the level 4. And so you recommend the 3 data points here. It's pretty general. Most of the time, everybody that comes in for dysuria gets a UA. Most of them get a culture. And so if you already are doing those 2, that's 2 data points. You could just leave it as a CBC, but other times you can add a urine pregnancy or any other labs that you feel is needed. And I just change the verbiage as we go to additional lab tests, or say 3 additional lab tests. But ultimately, you only need 3 data points for this. And I'll put these tests were declined today by the patient. And of course, if that's not true, I take it out. Or if we have 3 tests already, this is not needed in its entirety. So you don't have to put that. But ultimately, this portion alone gives you the 3 data points and the risks of complications. So you're practically there already, so long as you prescribe a medicine. And there's not a whole lot of UTIs that don't get an antibiotic. That would be cruel. So this is where your prescription medication management comes in for the level 4 chart. So before I ever have to change much of anything, I'm looking at a level 4. Something that also could help it is to make this, since this lady did have recurrent UTI symptoms, or recurrent UTIs, is to add the acute exacerbation of chronic condition, which also lets the coders know that this is another reason why you coded a level 4 chart on what seems to be a simple UTI. And so you're talking about some of your differentials that you're ruling out by looking at the assessment that you document, which needs to be updated on most. So a little simple differential down here that's already populated, and that's with every template. There's respiratory differentials. Dr. Kaltreiter and Dr. Reynolds put these triple dots here that are super easy to find, DDX, and there's a DDX for everything. And it's just that simple. You can put in DDX for chest pain and you have a differential list that will help you get a level 4 chart, due to these are the things you can't rule out in clinic. So anyways, that's where you find that under the differential diagnosis, which is very helpful. So yeah, looking at the chart as a whole here, we have our history of UTI, we have the acute exacerbation, we've got the differentials listed, and we have the medication management. So as easy as a simple UTI may sound, a very common complaint, now you know how to make them level 4s. So, and there's others. Deanna, is there another one you want me to do, or?
Nope, I think that's absolutely perfect. You've hit that as a level 4 in every element.
Perfect.
So Alex has hit that. as simple as possible to show is to get your differentials. She even showed how easy it is to get the shared decision making. It's already built into the template. And then she showed how to get the prescription drug management. This is a level 4 chart in every element. Uh, Anything you want to sum up to say how your journey finished to get all these pieces together to really make you get to the 90s every week at this point?
Well, I kind of now it's more fun to me because I see it all as a puzzle. There's new updates that you give out all the time, and every time there's an email sent, I make sure that I'm including that and updating all of my templates to fit that. Maybe not all at one time, but maybe today I see a bunch of UTIs, and so I'm already in that template. I'm going to update that template, and maybe tomorrow I'll get a different piece of information to add to a template that I'm already using, like a URI. But I kind of seen it as a puzzle piece. And, especially with the information that you gave out most recently about historians, I mean, that's such an easy and common place to start for a level 4. A independent historian can be anyone from a sibling giving additional information pertaining to what the patient is there for today, or the past medical history, or a spouse, which that's the wife most of the time coming in to say, no, he's had this for 2 weeks, he's lying. So there's always a different um, bit of information that I have used in helping me grow more towards getting level 4s. And now I guess I've grown so accustomed to seeing that it's that easy. And so knowing that it's that easy, and I'm wanting to, make the most of every every chart and do the best for the patient, and also what's best for the company. Why not utilize all of these things? You're being thorough. You're discussing these not additional medications, I'm sorry, these additional testing. And most of all of which I've found is something that takes 3 additional seconds in the room. We can run these tests, to see if there's something else going on. Most of the time the patient's like, no, I'll just take my antibiotic, and I'll come back if it's not better. So you're doing these, it doesn't take you any additional time in the room. And since I've learned that, I mean, now I don't see any other way of doing it. So I've just grown accustomed to it. I mean, and honestly, I've made it easy for myself because I've created the template where it's just a 1 or 2 clicks. And because of my templates, I've closed most of all of my charts either same day or the very next day. I have not gotten any dreaded Stephen Foltz text messages to lock my charts, because I have simplified the process for myself, which also helps me enjoy my job a lot
Love
more.
that, and I think that's a great place to end that. We are going to Alex is gonna be working to create her templates to make them public for everybody to go out and start using, so that you can get out there, start seeing what's in her templates, to start using those, and start going ahead and seeing those templates, go out there, and then start making them your own, so that we can have the greatest success for this company. Again, all of us are here. If you have any questions, please reach out, and good luck on your next adventure with differentials. Thank you all. Have a great day.